Gender identity is an integral aspect of ourselves. It's how we identify, but yet sometimes this can lead to discrimination, abuse, or even death, all because of how someone looks, how they identify, or who they love. Here with me tonight is Dr. Laura Saunders, child psychologist and clinical coordinator of the Right Track, a LGBTQ specialty track here at the Institute of Living at Hartford Hospital. And of course, this is Facebook Live, so we invite you to ask Dr. Saunders a question about gender identity, and we will do our best to answer all of those questions for you. Dr. Saunders, first, thank you for joining us.
Thank you, Tina.
You know, this is one of those topics that really needs to be discussed to sort of create that domino effect, because discussion leads to education, education leads to understanding, understanding ultimately leads to acceptance. And really, quite frankly, the reality of it is that gender dysphoria is growing, and we're seeing that right here in Connecticut. Right,
we're seeing it, and it is part of a national trend. And what I like to point out is that while it seems like it's a trend in that it's just a brand new issue coming up, gender dysphoria, transgender, what the Native Americans have called two-spirit, has been around for all of time. And it's not just here in our society, it's across cultures. So while it's an issue that has gotten much more play, it really has been around for a very long time.
And we're seeing more people coming out, if you will, with gender identity. Is it because, and like you said, it's always been around, is it because that they have suppressed it all those years and were afraid to come out?
Right. I always liken it to incidence and prevalence, right? In the same way that 50 years ago, autism, the rates were like 1 in 500. Now, on a state-by-state basis, it's about 1 in 150. It's the same for gender identity and gender dysphoria. You know, I recently saw something about a World War II vet coming out and identifying as female, whereas all of that individual's life, he had to identify as male. So some of the more big-name people, like Caitlyn Jenner or Laverne Cox, they're giving a more visible presence to this topic of gender dysphoria, but it has been around for a long time. And as we create the opportunity for this topic to be better understood, families can support young children to be who they are.
Let's talk about the youth, the transgender youth, the gender identity in youth issues. We're seeing more of that. You're seeing more of that in particular. How do you know, and from the family standpoint, how do you know, or even from the child standpoint, if this is just a trend that I see my friends doing, or if this is something that's really who I need to be?
What we look for in those situations is consistency, persistency, and insistence. So as we as a society really move away from the dualism, girls have to be girls and be very girl-like or be very feminine. Boys have to be masculine. As we allow a lot of cross-gender behavior and socialization, which to some degree we have, right?
Right.
So in 50 years, you know, women wear pants, women can play sports, men can be nurses. I mean, we've really moved away from the much more rigid gender roles that we've adopted for a very long time. But while we've moved in a direction, we still have a ways to go. So this is not about someone, you know, a young child, a young girl, say, wanting to play with trucks and cars and wanting to play male sports. This is a much different phenomenon. And what we're really looking for is the consistency of a cross-gender or gender dysphoric presentation. Not by a couple weeks and not even by a couple months. We're generally talking about years. We're looking at the persistence. How persistent is this behavior? Does it happen once in a while? Or is it like happening all the time? And the insistence. Does it seem like it's really driven from within as opposed to trying to blend into the environment around you?
And for the person actually struggling with their gender identity, how do they know for sure that this is real, or if it's just maybe a fad they're going through?
I've heard a lot of young people, some of the teens and young adults that I work with, say that it took them a while to get a word to describe what was going on inside of them. That it's not an easy phenomenon. I often like it to a salmon swimming upstream. You don't always realize why you're swimming upstream. Right. That the better we can provide information and education, it helps younger people put a word to what's going on to them, because that provides validation. The more we can be validated in who we are and accept the parts of ourselves, the better our long-term mental health will be.
Yeah, and at the Institute of Living, you're the clinical coordinator of the specialty track. Let's talk about that, because we're the only ones offering this. Let's talk about what folks can expect in this program.
So we are fortunate to be in this state, which is a much more progressive state than others. And in young adult services, I was given the opportunity 3.5 years ago to start this program. We have great programs in young adult services. We have an early psychosis program, we have a dual diagnosis program, and a general mental health program. However, this program and this track is really geared towards individuals who have underlying pretty significant mental health difficulties: bipolar disorder, mood disorders, suicidality, severe depression, overwhelming anxiety. I have a lot of individuals with social anxiety, and who also identify somewhere on the LGBTQ spectrum: lesbian, gay, bisexual, trans, and the Q is either queer or questioning. So it's for the particular issues that are part of this population and some of the more individualized struggles and stressors that they deal with.
Right, and some of that, and obviously, you know, we talk about stigma out there, and it's difficult for these folks to sort of express themselves and really be who they want to be. Can that struggle, that internal struggle, lead to these other factors like stress and depression and so forth?
So what I always say is that you take individuals who might have some vulnerabilities. You might have a genetic vulnerability to severe anxiety or severe depression, or familial vulnerabilities, exposure to domestic violence, or social vulnerabilities, living in low-income households or in a single-family household. You take individuals who already have vulnerabilities and you add on 3 additional stressors: social stigma, minority stress, and family rejection. And those 3 stressors are what tips the scales and causes LGBTQ folks to be overrepresented in the mental health population. It's not because they have an inherent connection to mental illness. It's because of those 3 additional stressors tip the scales, and it's why they're overrepresented.
We're talking to Dr. Laura Saunders. She's a child psychologist here at the Institute of Living at Hartford Hospital. We do want to mention a very important event coming up on June 6th at Real Artways in Hartford from 6 to 9 p.m. National Geographic will be screening their documentary, A Gender Revolution. It's a journey with Katie Couric about gender identity, roles, and issues. Immediately following that screening, Dr. Laura Saunders will be leading a panel discussion of endocrinologists, hormone therapy, to talk more about the gender role and identity. Give us sort of a sneak peek, because this is a wonderful discussion that folks should attend to really, again, it's that education piece, and the more we talk about it, and people are talking about this now, the better we can to eventually socially accept this.
So Tina, you know my passion is education, right, and outreach to the community, and that's really what this event is about. So National Geographic put together a wonderful documentary. It's not a perfect documentary, but a wonderful documentary that really talks about aspects of gender. Gender identity, gender nonconformity, non-binary gender, the difference between gender and sex, and it really provides a lot of good information. That screening is meant to, again, provide access to the community. After the screening of the documentary, we're going to do a panel discussion. We have Dr. Priya Fulwani from the CCMC endocrinologist and head of the gender identity program there. We have the president of PFLAG, Lori Davison, and a couple of trans youth. This is an opportunity for the community to have access to professionals and experts in this field to get the information and education that will help them better understand this topic. If they have a loved one or a family member or a neighbor or someone in their community, to better understand this topic, because the more information we get out there, it helps create a sense of change a little bit at a time.
You do need to register for this event and the panel discussion immediately following that, so you can do that by going to 1-855-HHC here to register for that event on June 6th. Dr. Saunders, let's talk about the family and society, because society does play a big role in this. Let's talk about the child who comes out to their parents and says, they were born a boy, but says, I want to be a girl. And you have parents that are maybe well-to-do in society who just cannot accept the fact that their child wants to be someone other than who they were born to be. What do you say to those family members? How do you get them to understand and accept this?
I think it's so important to validate. And again, as we said earlier, it's not just a one-time declaration. What we're looking for is the consistency of a gender nonconformity. But it's overwhelming for families as well.
Right.
Because parents, and it's my experience that parents for the most part do the best that they can. They have a vision and journey for their kids. Right. And when their kids veer off that journey, it's very, very disconcerting. And it creates kind of a mourning and loss process within themselves. So the more they can get support. PFLAG is an awesome, awesome support. There's chapters all over this state. It's a national organization, and it really is an organization that's meant to provide grassroots support for families who are dealing with kids who identify somewhere on that LGBTQ spectrum. Mm-hmm. And the more you can get information and education and support, the easier this journey becomes.
Right. And what we were talking earlier, and you were saying what parents should not do is resent their child or be negative toward their child.
The worst thing that we can do to our kids is create shame. Mm-hmm. The more we create shame, we are literally putting forth the process of social stigma that creates long-term mental health problems, worsening anxiety, depression. So creating shame is really a very, very damaging thing, to invalidate our child. And that's in the same thing if you believe that your son, you want your son to be an engineer, but they decide they want to be a ballet dancer, right? There's movies and shows about these things that we have to really try to put aside our own vision for our children and allow them to discover who they are and support that. Doesn't mean we can't impart our values as parents. Certainly we can do that. But we really need to be clear on what is in their best interest and validate and support their journey.
Changes and strides are being made. I mean, we were talking, of course, earlier, it took 30 years to get same-sex marriages to be accepted and to actually occur in states and for states to accept it. It took many years. Where do you see this happening with gender identity, transgender, and the LGBT community? Is this something that's going to take many years? Do we keep working at it? Where do you see this going?
I think change always takes some time. I've honestly been impressed that there's been a lot more change in visibility over the last 8 years. It remains to be seen what's going to happen over the next 3 to 4 years. However, the more we work to help each other, provide information and support, and increase visibility, and not just celebrities,
right,
but visibility, individuals who live on your block, who maybe work in your same workplace, who are in your same school system. There are kids in school systems transitioning all the time. Mm-hmm. The more we create visibility, it decreases stigma. Stigma is the expectation of rejection, and we're trying to decrease stigma by providing information.
Right. And to those that are struggling with gender identity issues, how do you talk to them or tell them, because they are discriminated against, there is abuse, there are criminal acts that happen to them. How do you tell them to deal with that sort of discrimination and even to that level of abuse? And now we have social media where there's bullying on there. It's a whole different world now for folks struggling with gender identity issues.
Well, that's why a group-based program like myself and group-based programs like even support PFLAG, we really work at, especially on those aspects. I call it kind of witnessing and mirroring, right? So the more you can realize that other people reflect parts of your identity, that's the mirroring. The witnessing is people can hear my story and validate and support that. So the more we can get individuals to step out of their social isolation, feel a sense of connectedness to people who share something in common with them, the more benefit it creates for those individuals. It's not easy. This journey's not easy, but it can be immensely gratifying to feel good about who you are and realize that you have gifts to share with the world.
Right, and people that are dealing with these issues shouldn't have to feel like they should suppress them. They should be able to live the life that they want to live.
Absolutely. And it really is about being able to put a name and a label to it, because that helps you then take some of those next steps in getting a connection.
Right.
And, the more we can bring this topic to the forefront, we are creating the change that needs to take place to provide safety and security for our young people.
Now, we had previewed this on our Facebook page on Monday, and we were getting a lot of folks that couldn't join the live Facebook chat but did write in some questions, so we want to make sure we get to them. Veronica writes, she works at an inpatient unit at another hospital. What can we do for our LGBTQ clients who are struggling with family acceptance and facing rejection if they disclose who they are?
So I think it's having an expectation for change. So it's not uncommon to see a lot of family rejection. That getting all the way to family acceptance may seem like a daunting journey. What we really want is to move people to tolerance. And there's easier steps to move people from rejection to tolerance than rejection all the way to acceptance. So the more we can provide information, visibility, support, connection, it moves people a few steps towards tolerance and better understanding.
And it's the not knowing, that people just don't know enough about this, and they've already formulated opinions, but in fact, if they knew and really understood and were educated, they could be changed. They
Absolutely.
might have differing opinions.
Absolutely. What creates the most change is exposure and visibility.
Right, and the discussion, and Caitlyn Jenner coming out really kind of amped up the discussion.
Right.
So there is a little bit of that celebrity influence, and
Yep.
I think it's definitely been helpful for the community. Rebecca writes, why is there an age cutoff on the right track LGBTQ specialty track? I'm 31 and I'm looking for a program like this, but it appears that I'm too old.
Well, right now I'm housed in Young Adult Services where we have several programs. So, but the benefit here at the Institute of Living in Hartford Hospital is that myself and my team can provide consultation to any of the programs on campus. And we do that regularly. So I'm obviously a huge proponent of many of the programs, behavioral health programs that we have on campus, because we have access to resources that maybe other hospital systems don't have.
Yeah. Dr. Saunders, what do you say to somebody who might be watching, or if somebody shares this with somebody who has struggled with this, they know it's not a trend, who has struggled with this for many years, their role as either a man or a woman to be on the other side? What do you say to that person who might be watching us right now and who's really struggling with this and afraid to come out and be who they really are?
The first step is to identify it to yourself, right? To take that very, very courageous step and say, this is who I am. I'm transgender, I'm non-binary, I'm gender non-conforming, I'm gay or lesbian. To take that first step, that's honestly the most painful step to take. Because once you take that step, it makes it a little bit easier to find a sense of connection. And one of the benefits of the internet and social media, and something that we didn't have when I ran a support group back in the 90s, is you can get information. There are online resources out there for people that need to have, better information. But that first step is really identifying it to yourself, because that's what then leads you to take that next step.
And there is help out there. There's programs like what we offer at the Institute of Living. There's programs for everyone, the family involved. You don't need to live with this internally.
Right. There are clinical programs and there are free community-based programs. I also run a support group that meets twice a month that is also free and open to the community for LGBTQ teens and young adults. So there are resources out there and there are free resources out there. The better we access and advertise and let people know, let the community know what resources are out there, the better it'll get.
Absolutely. We do want to just mention again that event that's coming up on June 6th at Real Artways in Hartford. It's National Geographic's documentary screening of the Gender Revolution, A Journey with Katie Couric. That'll be shown at Real Artways from 6 to 9. Immediately following that will be a panel discussion led by Dr. Saunders herself and an endocrinologist to really talk more about this issue and to discuss it, because it may be that first step. Somebody could be coming to this event at that first step. So we hope that you got something out of our discussion tonight with Dr. Saunders. Thank you for joining us.
Thank you, Tina.
As always. And we hope that you can make that event on June 6th. You do need to register. You can call 1-855-HHC here. Thank you so much for joining us for this live Facebook discussion. I'm Hartford Healthcare's Tina Varona. We'll see you back here next week.